Good afternoon. Today we're talking about non-surgical rhinoplasty. I'm Dr. Zunaid from Elite Aesthetics and welcome to this very short video explaining what non-surgical rhinoplasty is. It is basically referred to as a 15-minute nose job. It's referred to as just augmentation of the nose when you have a tiny little bump, or it can be a little bit more extensive. So the procedure involves using a dermal filler, which is usually hyaluronic acid based, such as Ultra Deep, in the nose to allow for some kind of augmentation. The patients who are suitable for this are patients who may not necessarily want to have a full surgical rhinoplasty or full surgical nose job. It's also for patients who may not be able to be put under anesthesia. And it's really for minor kind of cosmetic work and to improve the cosmetic appearance of the nose. A detailed consultation will be done, at which point the doctor will be able to assess whether you are suitable for the procedure or not, because not everyone is suitable. For example, if you've had surgical rhinoplasty or if you've had surgery to your nose, you may not necessarily be a good candidate for dermal filler unless you go back to the surgeon who did it, because they will know exactly what kind of technique was used and they will be able to place the filler in the nose more carefully. So what we do in a non-surgical rhinoplasty is essentially we work in the safe zone. So the safe zone is the entire midline. So it's everything up to and including the tip of the nose and kind of down to the fulcrum. So what can we do with that? We can sort out the bump in the nose or the dorsal hump, which is about 90% of what patients come in for. We use various different techniques. So for example, we might use a direct injection with a needle, or if possible, we use a dermal cannula just to provide a more smoother, more refined result. If we are building the bridge of the nose, for example, in certain population groups where the bridge of the nose may be a little bit flatter, we may adopt a cannula technique to be able to build up the bridge and to create that nice symmetry. When the nose is looked at from the side, most patients would like a ski slope kind of appearance. Sometimes we even augment the tip. It's called a supra-tip rotation, where using various techniques with the needle, we're able to actually prop up the tip of the nose and actually build it up from the bottom so that the nose is not kind of downward pointing, but that the tip actually moves in a superior or an upward direction. Can it be used to make your nose smaller? If it's done very carefully, it can actually be used to disguise quite a prominent kind of button nose, where you can achieve a small amount of lift in the tip of the nose with the filler and create a little bit of a pointy kind of effect with the nose. So yes, in that sense, it can make the nose look smaller. Sometimes when you rotate the tip of the nose and you move it in an upward direction with filler, you find that it actually makes the nose look a little bit smaller as well. So is it permanent? It's not permanent. It's a non-surgical procedure using hyaluronic acid, which is absorbed by the body, so therefore it is not permanent. Why we use hyaluronic acid is because we achieve very good results with it. The results are lovely and very smooth, but also should there be a problem with any kind of blood vessel blockage or any kind of pressure effect in the nose or an undesirable outcome, it is relatively easy to reverse the procedure using an enzyme called hyaluronidase, which will simply dissolve it out. In terms of longevity, we're looking at it lasting in the region of about 12 months to about 18 months. Some patients achieve a good 24 months. And the reason for that is because the filler is injected against very kind of hard structures, bone and cartilage, and the area of the nose is relatively immobile and it doesn't move. So for that reason, the filler tends to last longer because it's not in an area of mobility that's supported by a lot of muscle movement. If you have any questions or any concerns, or you'd like to discuss this further, the